It's time for St. Lucia Magazine, your monthly wrap up.
Hello and welcome to St. Lucia Magazine, your weekly roundup of the nation's top stories in education, the economy, infrastructure, agriculture, and more. I'm your host, Nival Auguste. In this edition, government steps up support for at-risk young men and special needs learners, and farmers receive guidance ahead of the dry season. The government is strengthening its focus on social development and education, with new initiatives targeting at-risk young men, special needs learners, and adult education. More in this report. The government has announced a series of initiatives aimed at strengthening social development and improving education outcomes, with a focus on at-risk young men, special need learners, and adult education. Prime Minister Philip J. Pierre revealed that government will enter into a strategic partnership with the CARE Institute to provide targeted support for young men considered to be at risk. He said the initiative is part of a broader social agenda driven by growing concern about the challenges facing young men across society.
I've always expressed concern as to what's happening to our young men in the society. And apart from the fact that we have many social programs, this year we are going to go into a strategic alliance with CARE, the CARE Institute, that has a very good record as it relates to putting the two factors together, work and dealing with young men who seem to be at risk. So we're going to be having a strategic alliance with CARE to supplement what we are doing now with the TVET schools and to supplement what is happening at SSDF.
At the same time, the Prime Minister announced that special needs and adult education will receive major attention in 2026 as government works to address long-standing gaps in literacy and learning outcomes. He highlighted the appointment of a dedicated minister for continuing adult and special education as a clear signal of government's commitment to tackling challenges beyond traditional classroom.
In terms of education, you may notice that we have a minister in charge of continuing adult and special education. That is very important to us, extremely important to us, in that we found that many children go through the system and by the end of the 5 years at secondary school, they basically are functionally illiterate because of different issues. And the teachers, they work very hard, but you need a special task. It's a special task. You need a special kind of curriculum to deal with special needs children. So we are working on that, and this year is going to be great emphasis on that. As a continuation of our early childhood education trust, we promise that early childhood education is going to be free in this term.
These combined social and education initiatives form part of a comprehensive strategy to ensure no one is left behind, while building a more inclusive, skilled, and resilient society. From the Government Information Service, I am Nival Auguste. The Director of Water Resources Management Authority advises farmers on strategic measures to implement ahead of the dry season. Kishma Serrier has the details.
Climate change has been blamed for the intensity of the dry and wet seasons in St. Lucia. Director of the Met Services, Virgil Saltibus, sought to bring clarity to the connection between the dry season and climate change.
It's not anything really drastic or really big that you could say like, hey, this is climate change, but it is in the subtle changes that you find affecting your day-to-day activities. For example, this dry season, we notice that it has a very high potential to be drier than usual. And this might lead to an evolving drought situation, where when we mention drought situation, we mean that certain restrictions have to be imposed on the people And then that causes you to think back to the last time that such an event occurred. And then you notice that it becomes a little bit more frequently than usual, but it's not outside the norm. So climate change is something that is a long-term trend that is evolving. It's evolving. It's not better or worse, but how it affects you will depend on whether or not it's bad or worse. For example, the tourism sector, the tourists will like the long stretch of days where you have nice blue skies, no interruptions to weddings, outdoor fishing, your boat rides, romantic boat rides. Oh, they love that. But from the agricultural perspective, food security is going to affect your agricultural harvest, your investment, your earnings from your garden, your farming, or whatever investment you have.
Officials continue to encourage rainwater harvesting and continued storage in preparation for the upcoming dry season. From the Government Information Service, I am Kishma Seria.
The Inland Revenue Department has launched a major strategic plan aimed at improving tax administration and service delivery with support from regional experts. Glenn Simon reports.
The Inland Revenue Department, IRD, has embarked on a major initiative aimed at strengthening tax administration and improving service delivery to the public. Senior management of the IRD, with support from consultants from the Caribbean Regional Technical Assistance Center, CARTAC, participated in a week-long strategic planning workshop held from January 12 to 16, 2026. Deputy Comptroller at the IRD, Fleur Simmons, said the department is working to develop a new 3-year corporate strategic business plan to guide its operations for the period 2026 to 2029. In the lead-up to the workshop, focus group discussions were conducted with key stakeholders, including the Department of Finance, local business associations, and staff of the IRD.
What we would have looked for in those focus groups is just anything that would inform us, anything that would assist us. So it's like an environmental scan into developing or determining the direction of the Inland Revenue Department.
Technical support to the IRD was provided by Princess Scott, a short-term expert with CARTAC. She emphasized that the development of the strategic plan is guided by a structured 4-pillar strategic management framework, which focuses on strategic priorities, strategic formulation, execution, and performance evaluation.
So we're starting off by looking at what we call the strategic intent, which is pillar 1, which is what are the strategic priorities from global direction, the Ministry of Finance, the government of St. Lucia, that from a tax standpoint will impact the IRD. We're then looking at pillar 2, which looks at how do you then formulate strategy. And strategy is the roadmap that will take the IRD to realizing certain key outcomes in keeping with its mandate, its vision, and its mission.
Strategic execution, particularly the mobilization of enablers such as human and technical resources to deliver and optimize results, forms part of Pillar 3. Scott added that Pillar 4 of the framework focuses on strategic evaluation.
So how does it monitor and measure its performance? How does it monitor and measure the health of key components of the tax system to move the IRD forward in supporting and funding domestic revenue mobilization, which is revenue being collected, revenue being buoyant for the people of St. Lucia.
The Deputy Comptroller of the IRD expressed optimism that the guidance provided by CARTAC will translate into improved services for taxpayers and a stronger, more responsive revenue system for St. Lucia.
Definitely improve service delivery. This is something that we would like to achieve, something that has come out of the focus groups as well. More interaction with the public, more information being disseminated to the public, just an improved taxpayer administration on the whole.
Beyond the workshop, the focus remains on building internal capacity within the Inland Revenue Department to ensure sustainability of the strategic planning process long after the consultants have departed. For the National Competitiveness and Productivity Council, Glenn Simon reporting.
Still to come, Minister Emma Hippolit begins engagements across her ministry. Stay with us.
Attention everyone, the nomination period for the Jimmy's People's Choice is now open. This is your chance to honor an unsung hero in the tourism industry. Do you know a tour guide who shares hidden gems? A villa host who made St. Lucia a home away from home? Or perhaps a crafty creator capturing the beauty all around? Nominate them now as we celebrate world-class service in tourism. Visit stlucia.org/Jimmy's. Nominations end December 19th, 2025. Nominate today. Jimmy's 2025. Journey to Excellence.
Welcome back. Minister for Equity, Labour, Gender Affairs, Social Justice and Consumer Welfare, Honourable Emma Hippolit, has begun a series of engagements across her ministry, signalling a hands-on approach to strengthening service delivery and coordination. More in this report.
Minister for Equity, Labour, Gender Affairs, Social Justice and Consumer Welfare.
Since assuming her new role, Minister for Equity, Labour, Gender, Elderly Affairs, Social Justice and Consumer Welfare, Honourable Emma Hippolit, has embarked on an extensive program of engagement and familiarization across her wide-ranging portfolio, signalling a hands-on and deliberate approach to advancing the ministry's mandate. From the start of the new year, Minister Hippolit has been meeting with key units and agencies under her purview, holding in-depth discussions with staff and leadership to gain first-hand insight into operational realities, service delivery challenges and opportunities for improvement. These engagements have included one-on-one meetings with the Labour and Gender Affairs divisions, as well as the leadership and staff of the Ministry of Equity and its core units, including Community Development, Human Services, the Welfare Unit, Administration, Accounts, and related support services.
Based on the question and answer sessions that I've had with the staff, I feel it is so important for the work that we have to do. Because in order for me to be the minister that leads this ministry, I need to listen to the staff, to hear their concerns, to hear the path that they have walked, the areas that they think needs addressing, as well as it gives me an opportunity to understand the ministries that I'm taking over. And it is with that understanding that we can work together to guide and make decisions for the future.
The minister has also engaged with satellite institutions critical to the ministry's social protection framework, including the Boys Training Center, Transit Home, Belfund, and Comfort Bay, recognizing their pivotal role in safeguarding vulnerable populations and supporting rehabilitation, care, and reintegration. As part of this initial fact-finding phase, Minister Hippolit has held intense dialogue with 2 permanent secretaries and met with several section heads, fostering open communication and reinforcing a culture of collaboration, accountability, and shared purpose across the ministry.
Today's meeting gave us the opportunity to discuss the alignment of the portfolio, and I am particularly enthusiastic about the discussions we had today and to see how we work together collaboratively to achieve the mandate of our portfolios.
Engaging with Minister Hippolit and PS Mbut have been a situation where we consider how we're going to align the departments, the different units within the ministry, and it has been very, very fruitful. We were able to create that kind of an alignment and synergy. But then from what I'm seeing thus far, I am very pleased with Minister Hippolyt's zeal and zest and PS Mbut's enthusiasm and willingness and commitment to take this entire ministry forward. We acknowledge it's a huge ministry with lots of responsibilities, but we all look forward to engaging and contributing positively.
Despite the breadth and complexity of the portfolio, Minister Hippolit has expressed strong optimism and enthusiasm about the way forward. She described the ministry as rich in institutional knowledge and committed personnel, noting that this foundation provides a solid platform for meaningful reform and impact. Arising from these preliminary engagements, Minister Hippolit has already identified short, medium, and long-term measures aimed at strengthening service delivery, improving coordination across units, and enhancing policy implementation in the areas of equity, labor relations, gender affairs, elderly care, social justice, and consumer welfare.
The Ministry of Health, Wellness and Nutrition is renewing its commitment to eliminating cervical cancer, highlighting major gains in HPV vaccination and expanded access to screening and early detection services across the island. Assistant Principal Nursing Officer Nurse Tekla Jean-Baptiste has the details.
As St. Lucia observes Cervical Cancer Awareness Month in January, the Ministry of Health, Wellness and Nutrition renews its commitment to ending cervical cancer as a public health problem, an achievable goal when we vaccinate, screen, and treat in a timely and equitable way. This aligns with the global targets for 2030, which aims to achieve 90% human papillomavirus vaccination coverage by age 15, 70% of women screened with a high-performance test by ages 35 and 45, and 90% of women identified with cervical disease receiving appropriate treatment. St. Lucia has already made meaningful strides towards elimination targets. Human papillomavirus vaccination is part of the National Vaccination Program introduced in 2019, targeting girls and boys aged 11 to 12 years in grade 6. Over the last 3 years, St. Lucia has seen increases in the HPV coverage in the target group from 70% in 2022 to 89% in 2024, demonstrating strong momentum towards the 90% target. The Ministry of Health continues to improve access to screening, care and follow-up for cervical cancer. There has been increased screening of women at the primary healthcare level, an engagement that we will continue to strengthen. Cervical cancer screening is now offered under universal health coverage from August 2024 as part of the essential package of health services. Through the program, human papillomavirus testing and liquid-based cytology has been made available island-wide. As of September 2025, 4,984 women have been screened for cervical cancer under UHC. Importantly, St. Lucia has program guidelines supporting early detection at primary healthcare level and a clearly defined referral system from primary to secondary and tertiary care, which are essential for ensuring abnormal results lead to timely follow-up and care. Services are available with a strong focus at the primary care level. Cervical cancer prevention and early detection services are offered throughout the health system, with primary care and community wellness centers playing a central role. HPV vaccination is available through the National Immunization Program, helping to protect girls and boys from HPV, the main cause of cervical cancer. Women can access cervical cancer screening services through community wellness centers, supported by program and referral arrangements to ensure continuity of care. Cervical cancer is one of the most preventable cancers. The Ministry of Health encourages parents and guardians to ensure eligible children receive the HPV vaccine on schedule. Women are also encouraged to get screened when due and keep follow-up appointments if contacted. Early changes can be treated before cancer develops. We call on communities and partners to help reduce stigma, share accurate information, and to support women and families to access cervical cancer prevention and early detection services. In January and throughout 2026, the Ministry of Health, Wellness and Nutrition will continue focused action to expand coverage, improve screening quality and follow-up, and ensure that every woman can access prevention, early detection, and care.
Coming up next, the 4-Hour Wellness Center reopens with upgraded health services.
Celebrating Excellence is a special 4-part video series produced for St. Lucia's annual Nobel Laureate Festival, honoring the extraordinary achievements of our 2 Nobel laureates, Sir William Arthur Lewis in Development Economics and Sir Derek Alton Walcott in Literature. Each year, the festival takes inspiration from their brilliance with a theme that reflects our nation's highest ideals. This year, we proudly present Celebrating Excellence, honoring our legacy, shaping our tomorrow. This series explores the global influence of St. Lucia's Nobel laureates, featuring insights from Dr. Claudius Preville, Ambassador at Large for Trade, Investment and Multilateral Issues, Ms. Crystal Riviere, Youth Economy Consultant, Mr. Giovanni Santoma, Design Consultant, and Mrs. Kathy Birch McDermott, Head Librarian at the Hunter J. Francois Library at the Sir Arthur Lewis Community College. Join us at venues north and south as we honor our past, inspire our present, and help shape our future. Follow us on Facebook at Nobel Laureate Festival St. Lucia. Request a program or call 758-284-2111 for more information.
Welcome back. The Ministry of Health, Wellness and Nutrition has officially reopened the 4-Hour Wellness Center following smart rehabilitation works, delivering upgraded, more resilient health services for the residents of the community. Fernal Neptune reports.
The Ministry of Health, Wellness and Nutrition celebrated the reopening of the 4-Hour Wellness Center, which was smart rehabilitated under the OECS Regional Health Project, making it a more upgraded and comfortable space for residents accessing health services. Minister for Health, the Honorable Moses Jabatis, along with the parliamentary representative for Babonneau, the Honorable John Paul Estefan, Permanent Secretary in the Ministry of Health, Jenny Daniel, and technical health officers, embarked on a walkthrough of the newly rehabilitated 4-Hour Wellness Center, highlighting the addition of features to make the facility more resilient to manage during a public health emergency or disaster. Permanent Secretary Jenny Daniel underscored the importance of visiting the rehabilitated health facility as to get first-hand look at the areas improved and to recognize the value of this for the delivery of health services to residents.
This site visit really was to commemorate the opening, to have a tour of the facility, to see the changes that have been made over the last few months, and of course to familiarize both of our ministers as well as our broader technical team with the working of the facility, to show areas in which we have improved efficiency, whether it be in terms of energy efficiency, the use of water, etc. And we look forward to, of course, improving our services, increasing efficiency, and of course ensuring that we maintain the center in a very smart way.
Minister for Health, Wellness and Nutrition, the Honorable Moses Jabatis, expressed gratitude to the contractor and representatives of the Ministry of Health and the OECS Regional Health Project, who played a pivotal role in ensuring the successful completion of the Wellness Center.
And I'm very pleased with the level of commitment here by the contractor, and also I'm pleased with the quality of the work, and I'm very happy to see some new equipment, new rooms for the medical professionals, to see clients and to see their patients, and I'm very happy with the new smarting facilities that are here, the generator, the tanks, and so many other inputs into this facility to make it a smart facility.
The Honorable John Paul Estefan, parliamentary representative for Babonneau, praised the transformation of the 4-Hour Wellness Center and voiced appreciation for the improved space, which is designed to enhance patient care and access of health services at the facility.
I believe it's a good thing to rehabilitate the facilities. Some of the facilities, because of age, they have a lot of wear and tear. They are old. There is need for us to modernize the facility. Healthcare is a big thing in St. Lucia, and especially for the government of St. Lucia. So we need the facility that can give our people the best in terms of healthcare. And when I look at what has been done at Foaso, I'm hoping that the same will be done at Babono and at Lage.
The Foaso Wellness Center is open to serve residents of the community from Monday to Friday, 8 a.m. to 4:30 p.m. The Ministry of Health, Wellness and Nutrition reaffirms its commitment to ensuring that health facilities are rehabilitated, a move aimed at guaranteeing an enhanced patient experience. Reporting from the Ministry of Health, Wellness and Nutrition, I am Fernal Neptune.
The Ministry of Health, Wellness and Nutrition held a high-level meeting with key stakeholders to strengthen coordination, planning and service delivery across the national health sector. Onika McCoy has more in this report.
The Ministry of Health, Wellness and Nutrition recently convened a high-level introductory and strategic meeting at the Bougainvillea Conference Room, Bay Gardens Hotel, with the aim of strengthening coordination, planning and service delivery across the national health sector. The meeting brought together heads of departments within the ministry, representatives from projects such as OECS Regional Health Project and the Caribbean Development Bank, and medical directors, chief executive officers and senior representatives from the St. Jude Hospital and the Owen King EU Hospital. The gathering marked an important opportunity for dialogue and collaboration among key stakeholders responsible for the management and delivery of public healthcare services in St. Lucia. The strategic session featured a series of presentations designed to provide a comprehensive overview of the ministry's operations, progress, and priorities. According to the Permanent Secretary in the Ministry of Health, Wellness and Nutrition, Jenny Daniel, the meeting served as a noteworthy opportunity to establish a shared understanding of the ministry's mandate.
During this meeting, we tried to begin to devise our strategies going forward, being armed with the information provided to us by Honorable Minister. And we, of course, had updates and presentations from some of our major program and projects being implemented over the last 4 to 5 years or so. So we really got a snapshot of what the ministry has done over the last 4 to 5 years, where we are, what is the state of health, what is the state of healthcare in St. Lucia, and basically what are the government policies that we need to consider as we strategize and as we move forward.
Minister for Health, Wellness and Nutrition, Honorable Moses Baptiste, used this platform to outline the government's broader strategic vision for the health sector, especially with the addition of the nutrition portfolio.
We want to work with all other ministries, all other government departments to ensure that in every aspect of our work, we focus on good nutrition and effective nutrition. So it is going to be very exciting. And I spent some time today to explain the objectives of the government over the next 5 years. We went through the manifestos of the party during our campaign, and to see what is in there for health, and to explain to the staff that the promises in the manifesto are really the blueprint for the way forward. And I was very pleased with the discussions. We looked at the completed strategic plan for health for the next few years, and also a number of other areas.
The Ministry of Health, Wellness and Nutrition reaffirmed its commitment to strengthening governance, improving health outcomes, and ensuring that the public health system remains responsive to the evolving needs of the population. From the Communications Unit in the Ministry of Health, Wellness and Nutrition, I am Onika McCoy reporting.
And with that, we wrap up this edition of St. Lucia Magazine. A heartfelt thank you to everyone who contributed to this production: the National Television Network, the GIS team, and the communications officers across government ministries. Thank you for watching NTN Channel 122 and following the official social media platforms of the Government of St. Lucia. I am Nival Ogist. Until next time, stay informed, stay engaged, as we continue tracking St. Lucia's progress.